Thank you so much for coming today. My name is Allison Rosen, and I am a colon cancer survivor. It is with deepest pleasure that I stand before you today to say that I survived this deadly yet preventable disease. Let me say that a colonoscopy saved my life, and colon cancer changed my life. So if you can have a colonoscopy tomorrow, I suggest you do, so that you don't have to go through treatment like I did. Today, I am joined by a few very inspirational people. We have Joe E. Ramirez, Brigadier General in the United States Army, and his father, Master Sergeant Joe Ramirez, who was a prisoner of war and served in both the Korean and Vietnam War, and is a colon cancer survivor. We also have Jackie and Vinnie Robbins. Vinnie was diagnosed with colorectal cancer at the age of 15. I was only 32 when I was diagnosed. So as you can see, colon cancer affects people equally. It does not discriminate, doesn't matter how old, what sex you are, what gender, it just doesn't matter. So we're here really to talk about that and the importance of screening. So March is Colorectal Cancer Awareness Month. Thanks to a coordinated effort by the Duncan Comprehensive Cancer Center at Baylor College of Medicine and the American Cancer Society, this week you will see nearly 50 buildings, bridges, City Hall, TMC, throughout the city. You'll see them shine blue. And they're doing this in support of colorectal cancer awareness. Not only that, but the American Cancer Society's giant 20 inflatable colon will also be throughout the city at various events to really nail the messaging down, the importance of screening, so people will actually get to walk through this colon, and it will be an interactive experience. So the one thing that we're having that we wanted to let you know is Poopery is having their giant poo tour, and we'll be at Discovery Green on March 13th. So besides they're gonna have a giant poo emoji, we're gonna have the colon too, because really, again, interactive exhibit, talk about messaging for colon cancer is really the way to educate the masses. So we'll be out there at Discovery Green on the 13th. So without further ado, please allow me to introduce Dan DeArmond, the Executive Director of the American Cancer Society.
Thank you, Allison. Thank you all for being here. Everyone want all Houstonians to come out to Discovery Green on Friday. Thanks to our friends at Poopery. For every visitor that comes out, they're going to make a $2 donation to the American Cancer Society. So we want to see all Houstonians come out there. Look, colorectal cancer needs to be talked about. When Houstonians see folks wearing pink, it immediately clues them into we need our loved ones to be screened for breast cancer. Yet colorectal cancer is the #2 cause of cancer-related deaths, period. And it's preventable. So during the month of March, when Houstonians see each other wearing blue or see a beautiful landmark lit up in blue, we want them to think, okay, I need to get screened for colorectal cancer. Some sobering facts, right? 1 in 23 will be diagnosed in their lifetime with colorectal cancer. 1 in 5 will be diagnosed by the time they're 55. That's why the American Cancer Society a few years ago lowered our screening recommendations to 45 years old. So if you're 45 and older, it's time to get screened. And in Texas, some 4,000 of our fellow Texans will lose their battle to colon cancer this year. Another 11,000 or more will be diagnosed this year. To prevent or even catch it early, you've got to get screened. And colonoscopies are not the only way to get screened. There are several other very affordable ways that you can do this at your own home. So listen, we don't want Houstonians to be some of those stats and figures that we talked about earlier. Please, please, when you see these beautiful buildings at the Texas Medical Center and around the city of Houston lit up in blue, that should be your call to contact your healthcare provider to get screened. Thank you, and thank you all for being out here.
Next, whoa, you moved it up. I will keep those okay. Next, we have Dr. Conwell, who is the Chief of Gastroenterology at Baylor College of Medicine and the VA Hospital.
Thank you very much for all of you to come out here today. The Duncan Comprehensive Cancer Center is one of the kind, and I'm really honored to be representing that center. It's a multidisciplinary, comprehensive center And collectively, it takes care of over half of the colorectal cancer patients in this area. It provides care at 4 affiliated institutions, the Michael E. DeBakey VA, the Bentap Hospital, Texas Children, and the Baylor St. Luke's Medical Center. We do provide excellent care, but also at the same time, really offer innovative research for patients with colorectal cancer. And I can talk a lot about that research, but really the point that I want to make is the best way to fight colorectal cancer is to make sure that we take whatever effort we need to take to prevent it. And this is one of those cancers where we have very effective preventive strategies that are available to us. There is testing that is stool-based. The stool needs to be checked for a few markers, and it can really identify patients who are at risk for colorectal cancer, which could be followed up with the colonoscopy. And of course, patients and you can go for colonoscopy directly as well. But there are many, many studies that have shown that colorectal cancer screening and prevention can reduce the risk of colorectal cancer and related mortality. So I really encourage everyone who is at risk, which is age 45 or especially 50 or above, to consider colorectal cancer screening, and we're here to provide the best possible care for you. Thank you very much for coming again.
Next we have Dr. Ben Musher, the Associate Professor of Medicine and Director of the GI Cancer Program at the Daniel Duncan Comprehensive Cancer Center at Baylor College of Medicine.
A couple years ago, I was sitting with a very nice, pleasant woman in her mid-60s whom I had been treating for metastatic stage 4 colorectal cancer for a couple years. She'd gotten surgery, radiation, chemotherapy, all we had to offer her. And she lived a couple years with her disease. She was getting tired, it was getting towards the end, and she looked at me regretfully and apologetically, and she said, "Doc, I'm really, really sorry that I had not gotten a colonoscopy when I should have at age 50. Unfortunately, I've heard that story many times. We've all heard that story many times. And we don't like hearing that story because it makes us feel sad. It makes us feel that we can't do enough for people at the point at which we see them, which is after they have cancer, especially if it's already spread. There's a lot in the press about coronavirus, understandably, but we have to remember there are other diseases that kill a lot of people. 50,000 people a year in the United States die of colorectal cancer. A lot of those cases are preventable, and I think that's the theme here. We always think about screening as good for catching cancers early. This screening method actually lowers the risk of colorectal cancer, prevents cancers in people by snipping out those little polyps before they can turn into cancer. And if they are cancer, hopefully it will catch those early as well. So I think the common message here is to get screened at age 45. That's now the American Cancer Society recommendation. Earlier, if you have family history or other risk factors for this disease, talk to your doctor about it. We can talk about stool-based testing or colonoscopy, but really the most important thing is to get screened. Most of us, all of us here, but most people in general would agree that drinking some prep, having a few loose stools at nighttime before your colonoscopy and getting your 15 to 20 minute test is a much easier and better situation than being diagnosed with a later cancer, surgery, chemotherapy for a couple years and dying. So please, don't let anybody tell you or anybody else that colon cancer screening is a big deal as far as discomfort or any bad things that will happen to you, because I can guarantee you that the cancer that will happen if you don't get the screening will be much worse. The second thing I want to bring attention to is young onset colon cancer. We don't know why, but colorectal cancer is increasing in incidence in young people. This does not appear to be genetic. We're testing everybody young people who come in with this cancer, but they're coming in with advanced cancers. We don't know why. It's probably something in the environment, diet, we don't know, but we and many others doing research on this question. My message for younger people and for doctors who see younger people is that just because someone is young, don't rule out colorectal cancer. Bleeding, symptoms such as having problems having bowel movements, abdominal pain, weight loss, those should be warning signs whether you're 15 or 20 or 25 or 30 years old. We have a young colon cancer survivor here today, and we admire him for the struggle that he has been through, but he and his family and all of us are here to also bring more awareness to young onset colorectal cancer. We're honored to have Sylvester Turner here today, who will give the same message. What we need to tell everybody, get the message out, is to get screened. Get your family, your parents, your siblings, everybody to get screened so we can prevent this cancer before it even happens. Thank you very much.
Now we have Bill McKeon, President and CEO of the Texas Medical Center.
Good morning, everyone. You see I'm wearing my blue already for colorectal awareness. You'll soon see the lights of our fountain come on in our police station. And you're going to see, with the help of our mayor, lighting up the entire city. I think it should just be a reminder. I'm one of those people that used every excuse, not listening to great medical experts, and I put off my test for 10 years longer than I should. And it's just so amazing that how often we make excuses for the fundamental things. I can tell you, went through the test, and I was kind of embarrassed afterwards how easy it was. First, you're not awake during the procedure itself. The prep is really not overwhelming. And just starting with a baseline of your health, and now that used to be 50, and now it's 45 years old. So when you see those blue colors, take it upon yourself to reach out to the people around you, family members, and just ask them if they've had it, and if not, encourage them to do it. It would be the fundamental in their life, if only to have a clean bill of health and to move forward. So do it for yourself. If you really love someone, let the blue light be a reminder for you to educate. It's all our responsibility to educate, and it's amazing what we can do when we learn. Power and knowledge is really everything in your life for a very long life to live. So think blue. And now we're going to turn it over to our amazing, amazing mayor of Houston, Sylvester Turner.
Look, let me thank Bill, and it's good to be with him, and it's good to be, Allison, with everyone again this year. And look, I'm delighted to be here. I forgot to put on a blue suit, but I do now find accessories. So I've got my blue hanky working right here. Look, let me just say that I'm delighted to be with you again this year. At a time when we are dealing with other health care concerns, we have to bear in mind that there are some other matters that we need to address as well. And colorectal cancer prevention, education, very, very important. And look, I'm honored to be standing in not only just with Allison, but with Mr. Ramirez, and it's good to be with him, and then with Vinny, and 15-year-old cancer survivor. Please give it up to all of them, both of them. Look, let me just say that March is Colorectal Cancer Awareness Month for the city of Houston. I've signed a proclamation I'm going to be presenting in a few minutes. And then just this past Saturday, I was with a group of individuals who were walking to bring attention to colorectal cancer. In fact, I've been with them for the last 7 years consecutively, walking. And I want to give a lot of credit to them, because prior to me joining them in their walk, I had not been tested. I had not had a colonoscopy, and Valerie was on my case every single year, and every time I came out, she asked, had your butt been checked? That's how she put it, And I told her no, and she kept on and kept on. And then finally, on the 4th time, she brought a doctor out with her. And she asked me again, and I said no. She said, I've already scheduled the appointment and everything for you. And then I went and got checked. And quite frankly, I'm glad I did, because they found several polyps. And so let me just say to all, especially to all of the men out there who have a tendency to put it off. It was one of the best decisions that I've made. It was painless, okay? And it was highly beneficial. So I want to thank people who every year bring attention to it, because we have to, and literally lives can be saved, and quite frankly, you can end up saving your own. So that's why it's important, and that's why I try to make it out. And then certainly it affects young people, Benny. It can affect women, it affects men, and it has a disproportionate impact on African American men for whatever reason. In fact, African American men experience colon cancer 50% more than white men. I don't understand why, but those are the realities. And an estimated 19,740 cases of colorectal cancer are expected to occur among blacks in 2020. So it's just important for us all to get tested. It is a non-discriminatory sort of element, and so it affects people across the board, but it is something that is highly preventable. But it's important that we draw attention to the testing, the education, the treatment, and the prevention. And that's why we are here, and that's why I want to tell my own story, because I was one who just put it off, until someone just kept at me, and I did, and I'm glad I did. And I believe that I've got an added extension on my own life, and we want people to have an added extension on their lives as well. So Allison, if you will, I'm going to present this proclamation. And what it says is that whereas colorectal cancer is the second leading cause of cancer death in the United States among men and women, and whereas 1 in 20 men and 1 in 24 women will be diagnosed with colorectal cancer in their lifetimes, there are now more than 1 million survivors of colorectal cancer in the United States. And Benny, why don't you come closer? Mr. Ramirez, come closer. And you are looking at 3 of them right here. 3 of them. And whereas the national goal established by the National Colorectal Cancer Roundtable is for 80% of Americans ages 50 and older to be screened in every community, a majority of colon cancer deaths can be prevented and treated through proper screening and early detection. And whereas during the month of March, Colorectal Cancer Awareness Month will be observed, and there will be several community outreach events scheduled around Houston to help raise awareness and educate Houstonians about colorectal cancer. And whereas the city of Houston commends all those involved in raising awareness and sharing information, as their tireless dedication is truly appreciated by all those affected by colorectal cancer, and extends best wishes on a successful observance. Therefore I, Sylvester Turner, Mayor of the City of Houston, hereby proudly proclaim March 2020 as Colorectal Cancer Awareness Month in the City of Houston. Thank you all for just staying in there. Thank you. Then I will present this. Bill, why don't you come a little closer?